In this video, we are going to talk about the 10 cancer symptoms that shouldn't be ignored. So before starting this video, please like this video and subscribe to this channel for our future updates. Let's be clear from the start, cancer is the most sneaky disease ever and can cause almost any sign or symptom. They can depend on the type of the cancer and where it is located, how big it is and how much of the body it has affected. The symptoms are most obvious if the cancer has grown or spread. However, it is possible to have an early stage of cancer with no signs or symptoms at all. This is especially the case with pancreatic cancers, which don't cause symptoms until they grow large enough to press on nearby nerves or organs. With other types of cancer, the first and most usual symptoms are fever, fatigue and loss of appetite, which all happen due to the cancer using much of the body's energy as well as the cancer affecting the immune system. The most important thing in successful cancer treatment is early diagnosis. This is why catching the very first symptoms is crucial. Unfortunately, most people ignore the first signs of cancer, sometimes because they don't recognize them, sometimes because they are too afraid or even can't afford to get medical care. Although many of these symptoms are usually not caused by cancer, they shouldn't be overlooked. But please, do a checkup. Also, do not skip on the recommend cancer-related checkups and certain tests for people even though they have no symptoms. In any case, you should know the general symptoms of cancer and how to recognize them. If you have some of them and they last for a longer period of time, then you need to visit your doctor. Here are the 10 early cancer symptoms and warning signs you shouldn't ignore. Number 10. Unexplained weight loss and loss of appetite. Sudden weight loss that isn't a result of a strict diet plan is definitely a warning that something is happening inside our digestive system. This can be connected to colon and other digestive cancers, but can also be a sign that a cancer has spread to the liver, which is unable to get rid of waste, resulting in loss of appetite. Feeling full and unable to eat can be a symptom of ovarian cancer. It is a fact that half the people with cancer lose weight by the time they get diagnosed, so take this early warning sign seriously and talk to your doctor. Number 9. Shortness of breath, wheezing or constant coughing. Shortness of breath can be a symptom of many conditions, most of them benign, but it is one of the first symptoms of lung cancer, and many patients aren't initially connecting it with this disease, which leads to a dilated diagnosis. If you are experiencing shortness of breath that is accompanied with wheezing and constant coughing, make sure you get checked as soon as possible. Number 8. Frequent infections and low-grade fevers. Cancer weakens your immune system, which causes more frequent infections and unexplained, usually low-grade, fevers that just won't go away. The fevers are usually present when the cancer has spread to a new area or that it is affecting the immune system. These symptoms usually appear with blood cancers like leukemia and lymphoma. Check the other symptoms of these cancers, and if you have some of them, do visit your doctor. Number 7. Sore that does not heal. What is great about our skin is that it has the power to repair itself very quickly, so any damage usually heals within a week or so. However, if you notice that a sore, wart or spot just doesn't heal even after several weeks, it is definitely time for a checkup. This goes even if the sore is painless. Number 6. Thickening or lump anywhere on the body. Cancers of the soft tissues of the body can often be felt through the skin. This includes breast cancer, testicle cancer, as well as cancer of the lymph nodes. Check yourself for any lumps or thickenings anywhere on your body and report them to your doctor, especially if you notice that their size has changed. Number 5. Change in bowel or bladder habits. Any radical changes in bowel movements as well as bladder habits should be immediately reported to a doctor. We are talking about long-term constipation, diarrhea, or a change in the size of the stool, which might be a symptom of color cancer or blood in the urine, pain while passing urine, or any changes in the bladder which can be related to prostate or bladder cancer. Number 4. Unusual bleeding or discharge. Any unusual bleeding can be a sign of cancer, both in its early and more advanced stages. For instance, coughing up blood can be a sign of lung cancer, while blood in the stool can be a result of colon cancer. Any unusual vaginal bleeding can be connected with cancer of the cervix. Blood in the urine can indicate that there is bladder or kidney cancer, while bloody discharge from the nipples can be a sign of breast cancer. Number 3. Indigestion or difficulty swallowing. Indigestion and difficulty swallowing usually aren't connected to cancer, but it is good to know that if these symptoms don't go away, they might be a sign of stomach, esophagus or pharynx throat cancer. Having difficulty swallowing can also be a sign of lung cancer. So if you are experiencing these symptoms for a longer period of time, do have a checkup. Number 2. Obvious change of the look of a wart, mole, or mouth sore. It is a rule that any change in size, look, color, shape, thickness of a wart, mole, freckle should be seen by a doctor as soon as possible. This includes any skin change because it can be a sign of melanoma or skin cancer, and for this type of cancer early diagnosis is crucial. If treated on time, it can be cured. If you are not sure what to look for, Google some images of skin cancer and skin conditions. Number 1. Persistent headache, fatigue, nausea, or vomiting. Extreme tiredness, persistent headache, nausea or vomiting that just don't go away can be a sign of a spreading cancer. Leukemia can cause fatigue, but this can also be a sign of colon or stomach cancer, which causes blood loss that can also lead to fatigue. Persistent headache can be a result of a growing brain tumor. If you have any of these symptoms and if they last for a longer period of time, it is time for a checkup. How to talk to your doctor about cancer. Physicians will often allow a few weeks to see if your symptoms improve or get worse. Even if you think your symptoms are mild, don't hesitate to talk to your doctor. A clinician should evaluate your symptoms and suggest testing or treatment if needed, then ask you to come back if the problem persists or gets worse, says Therese Bevers, medical director of MD Anderson's Cancer Prevention Center. Should you assume symptoms mean you have cancer? In some cases, early symptoms of various cancers can be identical to symptoms of other diseases or conditions. For example, Dr. Pasik cautions that some prostate cancer symptoms are similar to symptoms of benign prostatic hyperplasia (BPH) or an enlarged prostate. BPH is a non-cancerous condition that most men develop as they age. Prostate cancer and BPH share several common symptoms, including weak urine stream, frequent urination, trouble starting or stopping a urine stream, and blood in urine. If you do experience a symptom of cancer, see your doctor. But even if your symptoms are not acute, an annual physical exam is a good place to start talking to your doctor about what you're experiencing. Learn about cancer screening recommendations for prostate, colorectal, skin, lung, and other types of cancer. And be sure to follow the recommended guidelines for cancer screening, especially as you get older. A series of diagnostic tests, including blood tests and imaging tests, such as a CT scan or X-ray, may be required in order for the doctor to determine what is causing your symptoms. What do you think of our list? Let us know in the comment section below. If you enjoy this video and want to hear from me again, before leaving, make sure that you hit that subscribe button and the bell icon to get the notification of our future videos. Thanks for watching.